Migraines. This is a very common problem. A lot of people lose their work hours, days, because of this problem. It's a headache, very severe headache, throbbing and pulsating headache. It could be in one side of the head coming in. Some people have a classic migraine, which comes with aura. People can see flashing lights, they can be nauseated, and they have severe headaches. And others are simple migraines, which doesn't come with the aura, but they do have nausea and feeling of vomiting. The changes in noise and light can bother them. Any small amount of light even, they can exacerbate or worsen the headaches. There are several things that can happen to bring migraine to people. Any environmental changes, too much of heat, too much of cold, they can do it. Emotional problems, stress, anxiety, depression, excessive sleep, too much of sleep, or impaired sleep can cause that too. The work stress, some people have menstrual migraines, so they can have them at the onset of menstruation or before that. There are many factors that can worsen the headaches. Sometimes certain type of food can happen to worsen the headaches. Sometimes even chocolate can bring migraine headache in some people. So we have been talking about the different phases of migraine. There are 4 phases of migraine. There are some premonitory symptoms of migraine. There is an aura, and there is an actual headache, and then afterwards. So pre-monitoring symptoms are, some people can have it 24 hours before the onset of headache. They have the changes, unexplained changes in their behavior, mood changes that can happen. And then aura is where people see flashing lights, nausea. They can tolerate light. After that, the headache comes with nausea, sometimes vomiting, and then finally, when the headache is over, they have a period in which the people are very stressed, and some people get confused and very weak. People who have migraine headaches, usually they understand, they figure out what is the trigger for the migraine, and those triggers need to be avoided. If someone is in a stressful situation, the stress management will be a key thing to prevent migraines. Regular and adequate sleep is something that helps people prevent migraine. And environmental stress, not exposing oneself to too much of cold or too much of hot weather, rest, enjoyment, and of course stress management, as I mentioned, are important factors. There are certain things that we do for migraines. People can actually prevent migraine by taking different type of drugs, and there are some medications that are used, some pain medications, and there is a group of medication called triptans that are very useful for people having migraines. Once the symptoms come, or even the premonitory symptoms coming in, when someone can understand the migraine is coming, they can take those medications and prevent a full-blown attack of migraines. And there are certain medications that are out there that can prevent migraines. So if somebody has frequent migraines, they should take preventive medications for the migraine.